wanted to be a researcher and scientist when I was in about the 6th grade. My first real exposure to science left me with a lot of curiosity about the scientific world and about how science interfaced with nursing and medicine, in how to provide better care to patients and their families and how to improve healthcare systems are all things that going back and becoming a scientist in midlife has enabled me to do. So very early on, and a patient wait for it to happen.
I'm inspired every day as a nurse leader because I feel a special blessing and an opportunity to be able to offer a practice environment and support the kind of care that I know that we would want for our own families. As a nurse administrator, one of my responsibilities is to make sure that I'm able to provide resources and benefits and jobs for nurses and great nurses. This week I had a family who came back to see one of our nurses, and she had switched her shift so that she could be there with a young patient who passed away. And this nurse is only a couple of years older than this patient. And the family remembered that, and 6 of them came back to tell her thank you for changing her shift to be with that patient and with the family. That inspired me because she didn't have to ask a manager to do that. Nobody knew that she was changing her shift, but she had bonded with this family enough to want to be there to help them through this difficult time. And people like that inspire me to continue to do what I do every day so that I can help them do what they do. One of the things I appreciate about education is that I think students need to take advantage of the opportunities, not only to grow and learn, but to promote your career. And one of the things that I started early on in my educational processes at UK was to have clinicals and rotations and preceptorships with new people that were different than I'd been exposed to in my jobs. Through that, I developed a love for nursing administration because at the time I was a staff nurse in the operating room when I started in the bachelor's program. And then in my doctoral program, I was able to work with Dr. Pat Howard and do more publications than I had done before, and really establish myself as a writer in peer-reviewed journals. And so to me, that's the value of an education, is setting yourself apart and using those opportunities to be able to develop your portfolio for your future career. I have great memories of the College of Nursing because, for one thing, I've spent a lot of years in the College of Nursing. I have 3 degrees from the college. In my bachelor's program, the faculty were tolerant. I was a working adult at the time. I started the program with no children, and 7 years later finished the program with 2 children. And so I have great memories of crying in the clinical 2 days before my son was born, and bringing my daughter to intersession to finish classes. And the faculty supported me and knew that I was a working adult and trying to balance a lot of priorities. And I think that's probably my best memory, is that I realized that faculty understand and they're willing to work with you when you want to make a success of yourself. With my master's program, it was an amazing opportunity because I got to do some rotations at the University of Kentucky Hospital, and I became acquainted with Dr. Diana Weaver, who I'd admired from a distance. And so one of my best memories, I think, is getting to spend time with Diana as a nursing student in the master's program, where I really developed a love for administration. Then 17 years later in the doctoral program, some of my best memories are the weekends that I got to spend with my class, because we would come to class one weekend a month and then we would do our papers and things on Blackboard the rest of the time. And we really bonded. We had people that came from Tennessee and Maine, and Colleen Swartz from Lexington, who had been a friend of mine, and we developed a different network, and one that we appreciated each other. In the college, in that class, there were 3/4 nurse practitioners, and 1/4 of us were nurse administrators and educators. And so it was a real opportunity for us to learn the other side of nursing and to help those people with things that we were good at, like business plans and presentations, and to learn from them how much they wanted to demonstrate the business case for things where they could make an impact in their career. So great memories over many years of the faculty and my friends, and now many of the faculty that are my colleagues now.
I came straight from a farm in a high school graduating class of 33 people into the bachelor's program here on main campus at UK. And in the 4 years that I was here, I got to make up for the lack of resources that I had had coming up in a very small rural high school, and learned everything from science and anatomy and physiology to assertiveness training, because the dean at the time told us no one coming out of her program would ever be told what to do inappropriately by a physician or make coffee for them, that we were to be peers and colleagues. And so we had assertiveness training, role playing, and a lot of excellent role modeling from a very powerful female who wanted to make sure we were very strong. I developed a love for the profession because it did not take me long, as I was exposed in my clinicals to all the different types of nursing, to realize that if you were a nurse, you could really be anything that you wanted to be. And learning the nursing process helped me understand how to problem solve in every job that I have ever done. Assessment, setting goals, making plans, and seeing if you've achieved your goals has carried me through in very tough corporate business environments and in my research today. I have two really great memories from my time here as a student at the school. The first is, of course, graduation, because my grandparents, my parents got to come and go to the individual handing of the certificate of graduation that we got over in the Memorial Church building. That was personal, and they all cried and they were all happy because for my mother's side of the family, I was the first college graduate that had ever walked across the stage and gotten a diploma. My second memory is one that's really kind of funny. When I was in the community health rotation, my last semester of college, we were given the task of doing a community education project. That could either be writing an education pamphlet, doing a speech, or whatever we wanted to do. At that time, I was the manager of an apartment building on Rose Lane, right next door to the Sigma new fraternity house at the time. And I decided that I would host a wellness fair in my apartment building on a Saturday. And I borrowed equipment from the county health department, from the college, and from the cancer unit at Good Sam. And we had about 60 people show up in my apartment, mostly males. And we did everything from checking hematocrit and hemoglobins to breast self-exam education and height and weight and BMI calculations. A high number of frat boys came over. It was quite entertaining because they all wanted to do the exam on the fake breasts that had tumors in them. And it was funny because two of them who asked to do that had lost their mothers to breast cancer. So my initial thought was, oh, what have I gotten myself into? But of the 5 that asked to do that, 2 of them had actually lost their mothers at a very young age to breast cancer. And they were very concerned that their wives might miss something and they needed to know what it felt like when they got married. And it was my first experience doing things with the community, and it was well received, and I was literally floored by the attendance of the people. So it was great.
I first knew I wanted to be a nurse when one day there was a knock on the door at my home when I was a young child. And it was the public health nurse from the Lexington-Fayette County Health Department. And she came to our home to see my brother, who had a health problem. And I was so enamored with her in her approach to my family and what she was doing that I said to myself on that day, I want to become a nurse.
My all-time favorite leadership book is one that's a little more recent, and I know that a lot of women especially have read it. It's called Lean In by Sheryl Sandberg. And she recently also wrote a book called Option B, which is also sort of interesting. But I read Lean In as a recommendation during my RWJ fellowship. And I was a little skeptical about the theme, but then once I started reading it, it not only talks about leaning into conflict and almost embracing it as a matter of course in leadership, and how you have to, manage that and not to shy away from it, which we tend to do, to sort of back up and shy away from conflict. But there is also a lot of rich information in that leadership book about women in leadership roles, and that women do belong at the table, and often our tendency is to feel like we're imposters at the table, and that we also as women need to lean into these leadership roles because we belong at the leadership table and we have a completely different perspective to bring.
My education from the University of Kentucky actually laid the groundwork for my development in nursing, and the opportunity then to go on for graduate education and to become an educator of nurses. So basically, it was the foundation for my future and the development of my specialty area of practice.
My baccalaureate degree in nursing is from UK. My doctorate of nursing practice is from UK, and I also have an MBA from the Gatton School at UK. And one of the things in terms of education, one of the advantages I've had is, I think it's an advantage, is that I've worked full-time every time I've gone back to school. I wasn't in a position not to. And so, especially in the doctoral program, it allowed me to sort of hear, listen, absorb concepts, and then have sort of a laboratory to apply them because I was working all the time. And so I think that was, it's not unique to me. We have a lot of people who are working and going to school, and it can be very onerous at times. But I tell people every time I went back to school, it changed me when I came out at the other end, even though I might have been skeptical at the beginning. But you come out changed with new skills, new networks and connections. The other thing I think, especially in the doctoral program, is that we were cohorted with nurse practitioners from really all over the place, out of the state, from the Northeast. And at first I was like, do we really have a lot of common ground with nurse practitioners as nurse executives? And I found that it gave me a better understanding of the nurse practitioner work and priorities. I think it gave them a better understanding of executive nurses and nursing leadership. But at the end of the day, it's all about leadership skills and competencies in relationships. So I think my education at UK in the doctoral program especially was very rich in that way, and I still keep in touch with some of the folks that I met during my journey in the doctoral program. So I think it laid a foundation for me to continue to build and continue to realize the importance of relationships and networks and building those.
The College of Nursing opened in 1960, and I entered the program in 1964. And the program was just really beginning to develop at that point in time, and I was already a diploma nurse graduate. So I was entering as an RN already, and entering the program to, of course, attain the baccalaureate so I can move on to other things, as I mentioned earlier. But the one thing that I really enjoyed was that I had a group of RN colleagues that were just fantastic. And we studied together and worked together and developed our new skills together. And they are still friends. So there were only 8 of us, and we became very close. And to this day, we are still friends.
I'm not sure what Karen talked about, Karen Hill, but we were in the program together. Of course, Karen was full-time because everything's full-time in Karen's world. But we started together, and during we had class on Friday evening and Saturday morning, and during one of our sessions, Karen was planning her daughter Melissa's wedding. And so, Karen's already 125%, but there was a time where like even Karen was like a little disheveled, which you never see her like that at all. And so, we were all trying to rally a bit to support, the fact that her life is completely scheduled, and now we've inserted a big wedding, and she's a perfectionist. So that was a really sort of a fond memory of the doctoral program anyway. And I do think the memories and the takeaways I have of what I learned from the folks who were practicing nurse practitioners. We had a nurse practitioner who was a midwife who was practicing in a very busy obstetrics practice. We learned a ton from her just about that flow and the volume of patients they were seeing. And she was also doing work with adolescents with HPV. And it just really, makes you step back and think about how nursing practice permeates so many venues that you don't even know about. So it becomes sort of very eye-opening. And then I would say the funny story is that I got accepted to the program, and the first class day was going to be on a Saturday morning. And my alarm didn't go off. And so I had recently, I don't remember how long I'd been the chief nurse, but it wasn't that long. And so class starts at 8, and I woke up at, 7:20. I mean, it was bad, right? And so many of the students in the class are people who work at UK Healthcare. So I am like racing I showed up to class disheveled and not ready to go for the day. And I wasn't too late, but Pat Howard was there, Dr. Howard was there, and she was gracious, as she always is, but it's a very humbling moment when you have to walk into a class that has some of your own team in it, and you're like 15 minutes late on the first day of school. So I do remember that. It was not a fond memory, but I can laugh about it now.
There is one reason to be an educator, and that is to educate students so in the future they will exceed, not only sometimes exceed your expectations, but also excel and move further than the educator has in their own career. The doctoral program, I was a part of the doctoral program. It was a very outstanding opportunity for us as educators to be involved in the development of that doctoral program, both here and nationally. And there is one thing that I can say, and that is that this young lady was in one of my classes.
Yes.
She was my student.
Absolutely.
And she is a star, and she will exceed far beyond the faculty that taught her.
That's so kind. It's interesting. I think that translates to leadership, because I always say that anybody who I work with, I think I have a job to make them more successful than I am.
Yes.
And so we need to have a conversation. Like, what do you need? What are the gaps? What can I do to set a foundation or set the stage for you to be more successful than I am?
That's right.
And so it's
So
interesting that it's a similar sort of.
We all do the same
Yes,
thing, right?
it's
In our own
true.
way. Yes.
It is. It's true.
Right.